Driving is an activity that requires our full attention and sharp reflexes, ensuring not only our safety but the safety of those sharing the road with us. However, it may come as a surprise that certain medications can significantly impair your ability to drive safely. In this video, we will explore the top 10 medications you should avoid when you are behind the wheel in the United States. Driving under the influence of medication can pose significant risks to both the individual behind the wheel and everyone sharing the road. Medications, particularly those that induce drowsiness, impair coordination, or affect cognitive function, can compromise a driver's ability to react swiftly and make sound judgments. The consequences of such impairment can lead to an increased risk of accidents, injuries, and even fatalities. It's crucial to heed the warnings and recommendations provided by healthcare professionals, prescription labels, and medication guides, and to be aware of the potential side effects of any medication you are taking. Prioritizing safety and making responsible choices regarding medication use and driving can play a pivotal role in preventing accidents and safeguarding lives on the road. Let's take a look at medications you should avoid when driving. Number 10. Benzodiazepines. Benzodiazepines are a class of medications commonly prescribed for the management of anxiety and sleep disorders. They work by depressing the central nervous system, inducing relaxation. This effect, however, can lead to drowsiness, dizziness, and impairment of coordination and reaction time, a dangerous combination when driving. A study published in the Journal of Clinical Psychiatry found that benzodiazepines could increase the risk of motor vehicle accidents by up to 60%. The normal adult dosage varies according to the specific benzodiazepine and must be followed as instructed by your healthcare provider. Dosing intervals typically range from 1 to 3 times daily, and common side effects include drowsiness, confusion, and impaired coordination. Number 9. Opioids. Opioids are potent pain-relieving medications, including familiar names like morphine, oxycodone, and hydrocodone. Their effectiveness in alleviating pain comes at the cost of potential side effects such as drowsiness, impaired judgment, and slowed reaction times. A study published in JAMA Internal Medicine identified opioid use as a significant contributor to the increased risk of car crashes. The normal dosage varies according to the specific opioid and the severity of the pain being treated. Usage should be strictly in accordance with your doctor's prescription, typically administered every 4 to 6 hours. Common side effects encompass drowsiness, constipation, and nausea. Number 8. Antihistamines. Antihistamines are often employed to relieve allergy symptoms. These medications can cause drowsiness and blurred vision, both of which can severely hinder your ability to drive safely. A study published in the Journal of Allergy and Clinical Immunology has noted that antihistamines may impede driving performance. Dosages vary based on the specific antihistamine, with instructions usually provided on the label or by your healthcare provider. Dosing intervals typically fall between every 4 to 6 hours. Common side effects comprise drowsiness, dry mouth, and dizziness. Number 7. Muscle relaxants. Prescribed to relieve muscle spasms and tension, muscle relaxants can cause drowsiness and impaired coordination. These side effects are concerning for driving, as they can compromise your ability to respond effectively in traffic. A study in the European Journal of Clinical Pharmacology discovered that muscle relaxants could impair psychomotor skills. The normal dosage depends on the specific muscle relaxant prescribed, and it's crucial to adhere to your healthcare provider's guidance. Dosing intervals typically occur every 6 to 8 hours. Common side effects include drowsiness, dizziness, and headaches. Number 6. Sleep medications. Sleep medications are primarily prescribed to manage insomnia and other sleep disorders. They are formulated to induce sleep, but the lingering drowsiness and memory issues they can produce make them unsuitable for use before driving. A study published in Sleep Medicine Reviews demonstrated a direct association between the use of sleep medications and an increased risk of accidents. Normal dosage vary depending on the specific medication and individual needs. Typically, they should be taken shortly before bedtime and only once daily. Common side effects consist of drowsiness, dizziness, and daytime grogginess. Number 5. Antipsychotic medications. Antipsychotic medications are employed in the treatment of severe mental health conditions like schizophrenia and bipolar disorder. However, they can induce side effects such as drowsiness, dizziness, and muscle stiffness. These adverse effects can be detrimental to your ability to drive safely. A study published in JAMA Psychiatry has associated antipsychotic medications with an increased risk of traffic accidents. The normal dosage varies based on the specific antipsychotic and must be administered as directed by your mental health professional. Dosing intervals typically fall between 1 to 2 times daily. Common side effects include drowsiness, weight gain, and dry mouth. Should you have any queries regarding your medication, we've crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to explore it. Number 4. ADHD medications. ADHD medications, which encompass stimulants like methylphenidate and amphetamines, are prescribed for attention deficit hyperactivity disorder. These drugs aim to increase alertness, but they may also lead to agitation and anxiety. A study in JAMA Pediatrics have revealed that young adults using ADHD medications are at an elevated risk of motor vehicle crashes. The normal adult dosage varies depending on the specific medication and the individual's needs, and it should be closely adhered to following your healthcare provider's recommendations. Typically, these medications are taken once or twice daily. Common side effects include insomnia, nervousness, and an increased heart rate. Number 3. Antidepressants. Antidepressants are prescribed for the management of depression and anxiety. Some antidepressants can produce side effects such as drowsiness, dizziness, and impaired cognitive function, which can be problematic for driving. A study published in the Journal of Clinical Therapeutics noted that specific antidepressants are associated with an increased risk of traffic accidents. Normal dosage differ depending on the specific antidepressant, and adherence to your mental health professional's recommendations is essential. Typically, they are taken once daily. Common side effects involve drowsiness, dry mouth, and weight gain. Number 2. Anti-seizure medications. Anti-seizure medications are vital for treating epilepsy and other seizure disorders. However, they can produce side effects such as drowsiness, dizziness, and difficulty concentrating. A study in epilepsy research found that anti-seizure medications may impair driving performance. Normal dosage vary depending on the specific medication and the individual's requirements. They should be administered following your neurologist's recommendations closely. Typically, these medications are taken 1 to 2 times daily, with common side effects including drowsiness, dizziness, and nausea. Number 1. Sedative hypnotics. Sedative hypnotics are primarily used to induce sleep or reduce anxiety. They can cause drowsiness, dizziness, and memory problems, making them unsuitable for use before driving. A study published in the Journal of Clinical Psychopharmacology highlighted the association between sedative hypnotics and an increased risk of traffic accidents. Normal dosage differ based on the specific medication, and it is vital to adhere to your healthcare provider's instructions. These medications are typically taken once daily, usually before bedtime. Common side effects consist of drowsiness, dizziness, and impaired coordination. Awareness of the potential risk associated with a specific medication while driving is fundamental for road safety. Many of these medications serve important medical purposes, but prioritizing safety when taking them, especially before driving, is paramount. Always adhere to your healthcare provider's dosing and usage instructions. And if you experience side effects that impact your driving abilities, consider alternative transportation methods. Now, a quick question for you, our dear viewers. Have you ever taken medication that made you feel drowsy or less alert while driving? Let us know down below in the comments.